what's good for pregnancy. And these are areas we're going to talk about today on Lunchtime Live with the Center. Sharon Lavigne, who is a genetic counselor and research coordinator with MotherToBaby, is back with us. And MotherToBaby is a state-funded program that provides free, confidential, and current information on all types of exposures for women who are considering getting pregnant, who are already pregnant, or who are nursing. So welcome back, Sharon.
Thanks for having me back.
Well, so before we get into supplements, can you talk about what exposures mean? So exposures that women may call you about.
Well, really anything under the sun. So an exposure can be a medication, it can be a street drug, it can be an underlying medical condition, it can be, like we're talking about supplements, vitamins, minerals, herbal products, occupational exposures. We address those as well. So it really, or environmental exposures, it really can be anything.
Okay. And this is only for women, correct?
No, partners can call.
Okay.
Anybody who is in the process of trying to conceive or it has a partner who's pregnant, anybody can reach out to us. Providers use our service as well.
Oh, okay. So now supplements during pregnancy, why take them?
So supplements, and in supplements, I'm including vitamins, minerals, and then herbal products. I include those in what I consider supplements. And they can be used for a variety of reasons. Some people have deficiencies in certain vitamins and need to take a supplemental vitamin. Some people have underlying medical conditions for which they don't metabolize their foodstuffs properly, and so they're deficient in things and they need to take supplements. Some individuals have certain restrictive diets, and that may be by choice, or it may be because of a medical condition that keeps them from getting what they might need. They may be on other medications that deplete certain vitamins or minerals, or they may have a disordered eating process where they really aren't getting what they need.
Okay. And does pregnancy increase the need for additional nutrients, supplements in particular?
I think what we all think about is that prenatal vitamin that we get told to take as soon as we're considering pregnancy or we're pregnant. And the prenatal vitamins are designed to give you the recommended daily allowance for pregnancy, which for certain vitamins and minerals might be somewhat different than what they would be in the non-pregnant state. And you can read the labels. You can ask your provider for a prescription for a prenatal vitamin so that you know you're getting the recommended daily allowance for pregnancy.
Okay. So you were talking about vitamins, minerals, herbals. What supplements are okay, or what supplements?
Well, you want to look at a couple things. First of all, your doctor should have probably evaluated whether or not you have any deficiencies. And if you have a deficiency, a lot of people may have deficiencies in B vitamins or in D. And so your provider will suggest to you how much you need to take and for how long to get those numbers back up into the norm. Once you take a prenatal vitamin on top of that and you have an average or a typical diet, you're probably getting what you need to get. If you are considering the other additives, people a lot of times want to take extra C in the wintertime because they think it helps boost their immune system. We still are only going to rely on what do you need to take in pregnancy and look at that number. So if you're taking a lot more than you should need for C or other vitamins, it may be totally unnecessary and not really even be helpful.
So what should definitely be avoided in pregnancy?
Well, first thing, you always want to read your labels. Okay. So when you're getting any kind of product, putting anything in your body, you want to read the label. Anything that's sold over the counter is not regulated by the FDA, so the Food and Drug Administration. So what we are not able to tell you when you have a prescription, you're certain that what drug it says on the label is what's in the pill. You're not certain of that with anything you buy over the counter. That's not to say that everything is contaminated or everything is unsafe. It just means buyer beware. So there can be contaminants in there that you're not aware of, lead, especially in some of the herbal preparations. If they come from other countries, we can buy anything online from anywhere now.
Right.
You really need to be careful about the labels and really stick with the baseline of what what you really need. Lots of women are taking multiple supplements, vitamins, minerals, herbals, and combinations of those. And you may really be able to streamline that down when you're thinking of becoming pregnant.
Okay. And you mentioned herbals. So what are your thoughts on herbals in general? What, you know,
Herbals are tricky. And
yeah.
again, it's partly because of that, the FDA, they're not regulated. The second thing is what I have to do is look at what's the medical literature saying about such and such. And if there has not been any human data looking at a particular herbal supplement in pregnancy or breastfeeding or fertility issues, then I'm not able to tell you that's not a problem. It may not be a problem, but I'm not able to confidently tell you that based on the data, we're not expecting that to be harmful to you in any way. And then products have multiple ingredients in them, and there's no studies that talk about how they all interact with one another.
Okay.
Some of our herbal products can interfere with pregnancy hormones, so if you're trying to get pregnant, that could be a problem. Some bring on a period, and certainly that's not something you want when you're pregnant or trying to. It might interfere with what you're trying to do. Others can cause uterine cramping and other complications of pregnancy that would make us be wary about using them.
Are there any supplements that might be recommended for fertility and trying to conceive versus, and then should be stopped or not be used at all during pregnancy or breastfeeding?
I think, your provider, of course, is your go-to person for what do they think would be best for you to try to improve your ability to conceive. And that's where your center comes in, and they do a really good job of that. Then when you're out in the market looking to either buy that product because you're not given a script, that's when you have to read labels and make sure you're just getting what they told you to get. So let's say, for example, CoQ10, I think, is a product that the center recommends a lot. But when you go into the drugstore, there are probably 10 different preparations of that. So you want to make sure that you're getting what you really were supposed to get, not CoQ10 plus a whole bunch of other things, just a CoQ10. So you need to be careful about that, so you don't undo the good that you might be looking to do. I really leave it up to your providers to guide the patients on what they're considering, and then help guide them on that process in the drugstore, and how to search out and find which products are going to be better to consider versus the ones with multiple ingredients in them.
Okay. Any thoughts on how to choose a prenatal if it isn't prescribed?
Yeah. We have this fabulous blog on MotherToBaby that walks you through what is really necessary in a prenatal, because it's a little bit less than you might think, and in terms of how many vitamins, and then the doses for each. And I don't keep that in my head. So I really refer to that sheet, and it talks about the water soluble vitamins and how much you need. And it talks about vitamin A and how vitamin A can come in different forms. And the beta carotene form is the natural form that's going to be not harmful, but the retinol form can at very high levels be of more of an issue. So that it walks you through how to look for a prenatal. It also talks about the omega-3 fatty acids, so that helps you guide you on that. And it talks again about what I've already told you about herbal components, and how to look to sort of tease those out of your prenatal.
Okay. And also, what are your thoughts about shakes, like shakes as meals versus protein shakes? Some of them have added stuff to it.
Right. So protein shakes can be really great. Certainly if you're not feeling well, you have nausea and vomiting early in pregnancy, and you want to get some nutrients in, I would again say stick with the ones that have just protein in them. So they'll list a whole bunch of amino acids, and not a lot of other. They might have some vitamins and minerals in them, but look for ones that don't have added herbal ingredients, because that's when it gets tricky. So the straightforward protein shakes are certainly going to be things that you can use as an additive or a meal substitution if you're just not able to get a meal in. The baby's going to take from mom whatever he or she needs from you, so it would be you that would be suffering if you're not getting enough in, but we don't want your body to be stressed in that way too, if we can help it.
And we talked a lot about supplements, but medications are important as well in this, of course. How do you recommend what medicines are appropriate and not appropriate? Obviously, it's the science, but
The science, right. So we take a look at what we always look at risk versus benefit. So what's the underlying reason why she needs to take that product? And if she were to go without it, what would be the consequences in a pregnancy? And
okay.
if the consequences in the pregnancy would not be good, and the medication's benefits outweigh the risks, then that would be something that someone would stay on. So mental health medications, most of those women are staying on. If you're using, cosmetic products, makeups, and things that have medication in them for acne or psoriasis and things like that, we still do that risk versus benefit assessment. What can we do differently? Is it topical so it's less absorbed? Are there alternatives that you can try? And we would love to do that before someone gets pregnant so that they can tease out the things that they might worry about later, and get something more useful in place ahead of time.
And when you talk about teasing it out, is there a time frame that women should avoid trying to
Yeah,
get pregnant if they're on a
most
medication that is
Yeah,
not?
most things do not have a time frame. There are very specific medications on the market for very specific situations where there are recommended wait times.
Okay.
And most of your patients are probably not going to be on those, or they're going to hopefully have been well educated about those before they even started to take them. There might be a pregnancy prevention plan in place so that they don't accidentally conceive while they're on those products. But for the most part, there's not really a waiting time.
Okay. And last time we spoke, we talked a little bit about a study of the impact of COVID on pregnancy and breastfeeding women. Is that study still going on? Are there any
Yeah,
results that have come from it?
I think we're going to be good doing COVID for a long time to come, because we want to assess the risk for birth defects as well. And the vaccines have only been around for a year. We've only been in COVID for 2 years. So we need to see those kids growing and developing to see if there's any adverse outcomes. So far, we're not seeing that. We're seeing that the vaccines, at least the mRNA ones, so the Pfizer and the Moderna, which is what we have here in the States, those have not showed any significant increase for miscarriage or pregnancy complications, and in fact provide maybe even better protection than if a woman were to get COVID. And getting COVID in pregnancy can be very detrimental to a pregnancy. So our goal is to try to get everybody that's considering pregnancy vaccinated to start with, get your boosters, all in place.
And is this a study that you are currently recruiting for or looking for volunteers? How does it
We
work?
are. We are. So they can reach out to us, MotherToBaby. You can go to the website, mothertobaby.org, and click on the studies, and you can link and enroll yourself, or you can reach out to me, and I can help you get enrolled.
Awesome.
And
Sharon,
it's observational, so we're not going to make you do anything differently. We're just going to ask a lot of questions.
okay. All right, Sharon, thank you for taking the time today, and thank you for sharing this with us.
Thanks for
The
having me.
website is what again?
It's MotherToBaby, just like it says up here, .org. And you can reach me here at UConn at MotherToBaby at uchc.edu.
Excellent. All right. Thank you again. Our website is yukonfertility.com if you have any questions or need to learn more information about us. And we will see you next time on Lunchtime Live at With the Center. And bye for now.